Nerve pain. You wonder if you have it? Stay tuned and we'll be right back with you with more information. So let's talk about nerve pain. How many of you think you are out there living with nerve pain? This is something we see at the clinic all the time. I think it behaves in a certain way. So we created a scale. This will be the first time it's ever been introduced to the world. Something a little different and a different twist to the way you look at nerves. So sometimes it's numbness and tingling that brings people in here. Sometimes it's just that shooting pain that has a presentation that goes all the way down the arms, down the legs. Those are things we don't want to ignore because those are things that are being compressed, the nerves through the tunnels. So nerves behave a little bit differently than what we commonly think. They run through thousands and thousands of tunnels. And you know, the typical pinched nerve presentation isn't just like a cricked neck like some of our videos before, but it presents itself in a pattern. Sometimes it presents ourselves down our pinky finger. Sometimes it goes down the first two fingers or our thumbs. Sometimes, you know, sometimes that forearm pain. A lot of times I start believing that nerve pain is the genesis of a lot of our mechanical dysfunction. I actually think that in the next 20 years, I think we're going to find out that there's going to be more nerve pain issues that cause a lot of the mechanical issues that we have today. And I think that and inflammation are going to change and transform. So this is the first thing that we're going to talk about out here in the world and really give out the information that we give here. So let's stay tuned and I'm going to get back to you with our nerve behavior scale. So we'll flash this up real quickly. Our nerve behavior scale is something I decided to call it because I think nerves, whether you're going backwards and hurting yourself, go a certain way. So we call it the degenerative pattern. And if you're getting healing, you're also getting back to the progressive. So we've had my staff, Vivian Lee, did a great job. She did a great job in making these little pictures and little avatars for us. But this is a healthy nerve. And healthy nerves, you can do just about anything. It doesn't pull, doesn't snag, doesn't do anything crazy. You get to live your life, feel like you're strong, feel like you're not hurting yourself. Now the next stage is usually when things start kind of degenerating. I think of it like a rock kind of starting to press in. That pressure, whether it's because of neck positions, misalignments, they start creating this pressure. And sometimes people even describe it as stiffness. It's that stiffness in their hands, not realizing, hey, it might be the beginning of that carpal tunnel syndrome. And then the following is fatigue. That's also just feels like it's restless, fatiguey. Sometimes people have other descriptions in this department, whether it's itchy, burning, soreness. Then what happens is, because of the way it's compressed through these different fibers, think of yourself as like the cable that plugs in your laptop. You know, you have the outer wiring, those are the things being compressed. And then over time, the things in the middle, that copper wiring, is compressed. So that delays the signals. And we often think of that as nerve conduction. And so the modern tests aren't good enough. Those nerve conduction tests are actually more just telling us, hey, is the nerve viable? Does it transmit, you know, signals? And so what we need to do a little differently now is actually see that, hey, does it transfer or transmit the right signals? So the next thing that actually start getting hurt is that hot cold symptom. And it's a symptom of just things feeling like they're hot or cold all the time, hot all the time, some of that inflammation. But this is what usually commonly brings people in, the pain. It's almost like a snake bite. Bites right on the vein, shoots down your legs or your arms or anywhere in your body for that matter, and that really causes the next thing. Then moves on. If you continue to anger your nerves a little bit more, this is starting to move towards the danger zone. We're going to really see that tingling is something. So people ignore the pain quite a bit, and after they've ignored that for some time, they don't realize that tingling starts happening. That's when now you're really starting to squish the hose or the tube, and then the transmittance of the nerves doesn't go very far. So now these are the signals being affected. So that's why sometimes you'll feel it on, sometimes you feel it off, and hence the tingling on, off, on, off, on, off. You really want to think about that. And so that's really the next thing. But if you go a little bit further, then it's just off. And And how much off are we getting? Now we're getting down to that and really cranking on those copper wires down to the last fibers, and now we end up with two problems. You end up with numbness and or motor loss. This is the paralysis part that I've talked about in the next, and this is, you know, these little avatars, they really say it all. You know, are you numb, and are you loss of motor function? So numbness is classically the next thing that really starts kicking in. If you start letting it go, then numbness is definitely bound to happen. You know, if you don't get these things addressed, this is what needs to happen. This is what's gonna happen. So numb is the next thing. And so often people then will come in. But now we're so close to the danger zone where you lose that motor control. And that's, you know, 50-50 over here in the clinic, whether you get it back. So if you can get here in pain, guess what? We're gonna get back through the regenerative stuff and climb the ladder pretty quickly. But if you're here, we have a longer way to climb. Now, what people don't understand sometimes is that the nerve pain, you know, you might start with numb, but then it's gonna behave a little differently and it's gonna move towards pain. And some people, all the time, they always tell me, oh, Dr. Lin, I got here and it was numb, but now I feel pain. It's worse. In fact, it's not worse. It's actually part of this scale, and I always show them this. I always show patients that, hey, in the beginning, their first session, I educate them about our nerve scale, and this is what it's all about. So this is kind of the behavior of the symptoms that happen with nerves slowly start getting compressed. I think we need to pay better attention to this and nip it here, you know, and keep it healthy. I call it nerve hygiene. A lot of people call it neurodynamics and all that stuff out there, but I want to keep it simple here, and nerve hygiene is something we gotta do. So we've got some great exercises we do here, and you know, we'll eventually talk about those, but I think educating the public right now on when they need to start going to see someone and address these symptoms is the right way to go. So you can see as you're getting better, sometimes people have drop foot. That's a common nerve compression thing from the sciatic nerve. So you got the paralysis, then you move towards numb. So it's like, well, I could move, but now I can move my leg, but I can't feel anything. Or some people after surgery have nerve severed, they're numb. And maybe if it was a sensory nerve, it's just numb and not totally a motor loss. Then they move towards tingling, like all of a sudden you went from nothing back to tingling, you can start feeling something. So that's not worse, it's getting better. And then pain. Pain comes on, that means you're lightening the load, the pressure's coming off, you're starting to feel the pain little transmittance of the signals. Then it moves towards the hot, cold, the pressure, the fatigue, and then you move back to healthy. And then that's it. That's how we start improving our lives. And those are the little things that we need to keep addressing. So if you like what we're doing, and hopefully you understood this a little bit, please subscribe below. We're gonna keep giving out information to help our public and help the community. If you have any comments, leave it below as well, or you can email us at rehabandrevivemedia@gmail.com. I'm Dr. Lin here at Rehab and Revive Physical Therapy. Remember, we can and we will get better together. So here it is. This is our nerve behavior scale at Rehab and Revive Physical Therapy. Remember, it's copyrighted by us, and please ask for permission. All rights are reserved for us. So here it is. We have healthy. And with healthy, we have the affected area with no symptoms. And then the next stage of degeneration is pressure, stiffness, fatigue, and usually it's experiential of heaviness, gripping, sensation, pulling, itchiness, and even a light inflammation, burning feeling. The next move is hot and cold. And so sometimes it's an inflamed nerve, feels hot, sometimes it's cold, and it's been there for a long time. So the next stage after that is pain. Pain usually is painful, and it's just whether at rest or with movement. Then moves into tingling. So tingling usually kind of feels like that pins and needles feeling. Then we got numbness. Numbness, I think that's pretty good enough, numb. And then we move to paralysis, which is loss of motor function. And that's our nerve pain scale, our nerve behavior scale.